Our research showed that we're in a situation where people know us and they know our brand, but their perception of us was that if they were really sick, they wanted to come to us, but they didn't want to come to us for everything else. And they thought, because of our association with the university and being an academic medical center, that we were a little ivory tower, standoffish. So we wanted to change the perception. We wanted people to think of University of Utah Healthcare as their lifelong health partner for every health need, and that we were friendly and approachable, as well as being experts. So content marketing for us was the primary way that we could change that perception in the community and throughout the Intermountain West, which is our service area. For us, content marketing is still about changing that perception, but it's evolving to now where it's also about promoting specific services as well as answering questions from the community. So we have two goals with all of our content, really, is how do we answer questions, keep health information fresh and engaging, not overly promotional, but also drive people to make the choice to come to us for their healthcare services. I think content is going to stay central to our strategy, but I think it is evolving in terms of there's so much health information out there. We really have to find ways to make sure that the health information that we're sharing is both useful, shareable, relevant, obviously accurate, but at the same time really be thinking about how to cut through the clutter, because there's a lot of health information available, and we want people to get their health information from us when they can. We have to be careful to respect privacy, obviously, in healthcare, so we don't track it out on an individual patient level, but what we really look for is, are people reading the content, then following that content to either a specific physician or a service area and requesting an appointment. Healthcare is interesting in that a lot of people will read health content anytime just out of interest, particularly if it's well written, which we believe ours is, but they only need the service when they need the service. So tracking the ROI has challenges, because sometimes people will read about a service and then not make the decision or have the need for that service for quite some time. But in those instances where somebody is searching for information, find our content, and go directly then to a service area or physician and make an appointment, that's the main source of ROI that we try and look for. We're really sensitive to the fact that healthcare and health is very, very personal, and in a lot of cases very, very private. If you're just interested in learning about strep throat, that's one thing, but a lot of other health conditions are very, very personal, very private. So we make an effort that our content is very non-promotional, that it is mostly just really good, solid information that then people will view us as the experts, as a resource, as someone they trust, because trust is a major driver for healthcare decisions. So for us, it's about having really good content that isn't overly promotional, because people will make the choice to come to us based on the content if the content is good, trustworthy, and delivers the message that they're looking for.